of a protocol that would define the management of the center, including the roles and responsibilities of the individual HFPI member countries. The Post-HFPI project is a 5-year eye health project from January 2009 to December 2013. It is funded by Sightsavers and the European Commission and is being implemented in the Gambia, Senegal and Guinea-Bissau. The goal of the project is to reduce poverty in the 3 intervention countries through improved eye health services. In the Gambia, the project covers the whole country, whilst in Guinea-Bissau, the regions of Wayo, Farim, Bafata and Kachu are covered.
In the Gambia, we already had some projects ongoing before the project started. So we are pretty much building on what was done here by the first HFPI project. But in Guinea-Bissau, we are in regions where there was nothing. So we went into Guinea-Bissau and built in new facilities and also trained eye health workers to cater for the population that were unserved. In Senegal, we are also operating in 4 regions.
The project is being implemented in partnership with the Ministries of Health of the Gambia, Senegal and Guinea-Bissau. Sightsavers works through the national eye health programs of these countries to implement the project. The Helen Keller International, which is based in Dakar, Senegal, coordinates the vitamin A supplementation with support from the nutrition agencies or units of the participating countries.
When the project started in 2009, our first region in Guinea-Bissau was Farim. In Farim, we started by building an eye unit in Farim Regional Hospital itself. And we also identified and trained eye health workers. We identified an ophthalmologist and also identified an ophthalmic nurse who came to the Gambia. The ophthalmic nurse came to the regional ophthalmic training program here in the Gambia for training. That was pretty much what we did. Other activities in Farim in that area were definitely like things like camps, cataract camps, sensitization of the population. And in the second year of the project, we went into the region of Bafata. And in the region of Bafata, we constructed a new eye unit in a settlement called Kuntubel. Kuntubel is a big village. It serves a big catchment area. And for those people who are unable to travel to the regional capital of Bafata, Kuntubel was a place where they can go and be attended to by an ophthalmic nurse. By the time the Kuntubel unit was ready, the cataract surgeon who was sent here for training had completed her training and was back to Kuntubel to serve the population. In the 3rd year, we went into the region of Kachu. Kachu, this is why we have a regional capital based in Kanchunku. Kanchunku was already operational. There was a cataract surgeon based in Kanchunku then, but this facility was refurbished. We went into another facility, another health facility in the region. This is called Ngore, and we are also right now trying to build an eye unit in San Domingo. Among the key interventions of the Post-HFPI project, support for human resource development. This entails the training of ophthalmologists and other mid-level eye health workers, including cataract surgeons, ophthalmic nurses, community ophthalmic nurses, refractionists, and the local production of eye drop technicians, as well as instrument technicians.
I want cataract surgery. I want to be a cataract surgery. I'm here for training about 11 months now. I came for 1 year, but about 11 months now in Gambia. I'm here for my practical. Yeah, I'm here almost about two months. 2 months for my practical.
Yeah, I feel great. It's an elevation and a relief on the patients because eye drops, there are some certain eye drops that cannot be even got here. But with the help of this course, we can produce eye drops for patients, and it's as effective as the ready-made eye drops.
I was trained in 2010 to 2011. We finished in 2010. And then we were on internship for a period of 6 months. Then after the 6 months, I was posted to Soma Health Center, Soma Major Health Center as a cataract surgeon. So here, we do cataract surgery, we do trabut surgery, we do pterygiums, we do chalasiums, so we do all those surgeries here. Also, we see patients with different types of conditions, glaucoma, conjunctivitis, pterygiums, pendiculums. So we see a lot of these hot climate diseases. So the ones that we can manage at this level, we manage them here. But the ones that we cannot manage, we refer them to the tertiary level, and that is SEGZ, the Regional Eye Care Center.
In 2006, I was enrolled at the Regional Ophthalmic Medical Training School at SEGZ Regional Eye Care Center, where I was trained as an ophthalmic medical assistant. That was in 2006-2007. I graduated, they posted me in Basse. Yeah, I was here up till 2009. When I have another chance to go for my advance. Well, the training, I must say, it has taken me to another level, and that is the essence of training. When I was here, I was an OMA, that is an ophthalmic medical assistant. In 2009, I received scholarship again from the post-HFPI project fund to undergo training at the Regional Ophthalmic Training School at the SEGZ Regional Eye Care Center. That also qualifies me as a cataract surgeon. Today, I'm privileged to sit on the care I am as a cataract surgeon because of that training I undergo. I'm able to take care of the eye care problem of the entire region of URR. Because of that too also, I must say, I'm able to effectively supervise the cons that are under me. I also conduct training on school teachers, training on nyateros who also go back to their various community to give good eye care, to serve as an advocate for good eye practice in their various communities. Well, here the bulk of my patients come from the Gambia, basically those in URR, and also a large number of them also come from the neighboring countries, Senegal, Guinea-Bissau. At times even you have patients, there was two patients that come from Sierra Leone and even Nigeria, but those ones are Gambians because of they had the quality of service that we are providing in the country, and also the amount involved is not costly compared to where they're staying. So they prefer to come to the Gambia to have their eye.
Would you say that is the main reason why many people come across the border to come to the
Well, the main reason is quality of service and also the cost. Still, our service compared to the other countries is still cheap.
We also support in terms of infrastructural development. This support includes building and refurbishment of eye units. In the Gambia, we refurbish Birkama eye unit, Basse, and in SL.
So I'm very happy that Sight Savers came and renovated some part of the eye unit. Now patients are forming, and it's eye-catching. Whenever you enter into a health center, you see that part of the renovation. And then even sometimes we convey our meetings in this unit, in this shape. So it's a very good step in the right direction. Government alone can't do it. So we need to have partnership, and then it's a very strong partnership, right? And I urge them to continue what they are doing, because whatever, let's say health is no one's business, but everybody's business. So someone coming like Sight Savers to complement what the government is doing is a very good step in the right direction.
In Guinea-Bissau, we built new eye units in Farim and in Kuntubel, as well as refurbished the eye units in Bafata, Kanchunku, and building a new one also in San Domingo. Here in SEGZ, some of our key investments include building a 30-bedroom student hostel for the students who come to the center, as well as lecturers' accommodation and private wards. As well, we also invested in a minibus for the ophthalmic training program. Another component of the program or support that we give to the national eye health programs includes support for ophthalmic equipment and consumables. This support includes equipment such as operating microscopes, cataract sets, tracheasis sets, and refraction kits. We also support the programs in terms of service delivery, including screening of patients in schools and communities, as well as support for ongoing awareness-raising activities on the prevention and management of prevailing eye conditions through community volunteers. In the Gambia, we call them nyateros, school teachers, radio station, we use posters, as well as other appropriate communication.